Welcome to the Public Health Action Curriculum for Teens, or PHACT. PHACT is a free, video-based public health curriculum designed for teens to learn about the public health issues that impact communities across New Mexico. PHACT was created by the University of New Mexico Center for Disaster Medicine and the Albuquerque University of New Mexico Medical Reserve Corps Unit. Let's talk about what you can expect. PHACT covers 5 main topic areas called modules through the audiovisual format. The 5 modules are health equity and public health careers, chronic disease prevention, emotional and mental well-being, first aid and CPR, and disaster preparedness. At the end of each module, there will be an action step. The action step is meant to create an opportunity for you to further increase your knowledge of public health by taking the information you learned and using it. We encourage you to get involved in your own community and to please share these experiences with us on our Facebook page. For general information and for updates, please feel free to visit our website at unmcdm.org. You can also find us on Facebook at facebook.com/Public Health Action Curriculum for Teens. Welcome to Module 1, Health Equity and Public Health Careers. Module 1 consists of 3 videos: What is Public Health?, Careers in Public Health, and Determinants of Health. By the end of Module 1, you should be able to explain what public health is, give examples of public health activities, understand how public health works in the United States, know about public health careers, and be able to explain what makes us healthy and unhealthy.
Over the past 10 years, the term public health has become much better known to the average person.
However, public health has been around for a very long time.
Some say public health began in ancient Rome thousands of years ago.
The Romans believed that cleanliness led to better health and put a great deal of effort into preventing disease.
Public health has come a long way since the Romans, and today has expanded to encompass many things.
Public health is around us everywhere, every day, and it plays a big part in our everyday lives
without us even thinking about it.
There are many definitions of public health, but for the purpose of this video, we will use the following.
Public health is about preventing disease and injury for a population of people.
Public health includes many fields of work and study that aim to identify the causes of disease and disability, and apply population-based solutions to prevent them. Public health spreads across all levels of government and into the public and private sector. People who work in public health may conduct research, they may educate others, or they may be a specialist practicing in the field. While many people work in public health, we all contribute to public health in one way or another. For example, by simply washing our hands, we help prevent the spread of disease and illness. Public health is closely related to healthcare, but is different. Healthcare focuses mostly on the treatment of disease in one person at a time. Public health focuses on preventing disease for a population of people.
So I do health promotion through Bernalillo County Office of Health and Social Services, and health promotion is defined by the World Health Organization as providing people control over the social determinants of their health. And so we really try to work with communities and community partners to help them take some control over their community and their community health.
Let's look at an example. If someone has the flu, they would go see their doctor, who would treat the patient and probably prescribe medicine, fluids, and rest. Public health workers, on the other hand, would not work with the patient directly. Public health workers would conduct research for a vaccine to prevent the flu, or send out messages about hand washing and hygiene to prevent the flu. Public health and medicine together create a system that can keep us all healthy by working in different ways. In public health, disease prevention is defined in 3 different categories: primary prevention, secondary prevention, and tertiary prevention. Primary prevention activities prevent the disease from occurring in the first place, such as by wearing sunscreen to prevent skin cancer. Secondary prevention activities are used when a certain group of people is known to be at risk for a disease or has early signs of disease, and include things like mammograms or taking aspirin to prevent a heart attack. Tertiary prevention targets or treats the person with the disease to keep it from getting worse, such as treatments for skin cancer. Some diseases benefit from all three types of prevention. For instance, primary prevention of diabetes includes eating a nutritious diet and exercising regularly to prevent obesity. Secondary prevention includes a person modifying their diet due to signs of prediabetes, and tertiary prevention includes taking medication to control blood sugar levels after diabetes has developed. Public health has made many achievements over the last 100 years or so. One result of these achievements is the increased life expectancy. Today, the average American is expected to live to 78 years old. In the early 1900s, life expectancy was only 47 years old. Vaccinations, recognition of tobacco as a health hazard, clean drinking water, and proper sewage systems, and motor vehicle safety are a few examples of some of the great achievements made in public health. These achievements took years of dedication, research, policymaking, education, and promotion. Now they seem like the norm. Public health today remains focused on improving past achievements and allowing everybody to have access to them. Public health includes many activities. Let's talk about these in greater detail so we can learn what public health is.
First, public health activities prevent epidemics and spread of disease. An epidemic is an outbreak of a contagious disease, meaning a disease that is spread from person to person. Many contagious diseases are easily preventable, though. Public health prevents the spread of epidemics and disease by promoting healthy behaviors, such as hand washing and vaccinations, through public educational campaigns and by investigating outbreaks. Public health works to prevent many environmental hazards, train people how to properly protect themselves from these hazards, and creates plans for dealing with them if they do occur. Environmental hazards are dangers found in the world we live in, outdoors, in school, at work, or in our homes. These environmental hazards are non-infectious, meaning they are not transmitted from person to person. Some examples of environmental hazards are food poisoning, lead found in paint, pollutants in drinking water, floods, or fires. Another goal of public health is to prevent injuries. Although injuries and violence are preventable, they are the leading cause of death and disability in the United States. Public health workers study injury threats, and violence, and promote programs, activities, and practices that educate, save lives, and protect people. Areas studied in injury prevention include motor vehicle safety, dog bites, school violence, concussions in sports, and more. Public health activities promote and encourage healthy behaviors. This is done through research, education, and program development. Public health promotes these healthy activities through education activities, social media, advertising, and other messaging outlets. Public health assists communities in the preparation of, response to, and recovery from emergencies and disasters. Disasters and emergencies can disrupt the healthcare system, cause loss of life, damage to property, and have enormous economic consequences. Disasters and emergencies are not always preventable, but disasters and emergencies can be prepared for. Preparing for a disaster or emergency lays the groundwork for the response. Since the health of the public is tied closely to the health of individuals, another goal of public health is to assure the quality and accessibility of individual healthcare services. This includes providing free or low-cost basic healthcare services, vaccinations, and disease screening for people who cannot afford it on their own. Lastly, one of the most important public health activities is the creation and enforcement of laws, regulations, and policies to protect people from harm. Many important human health improvements have occurred because of strong public health laws and regulations, such as the requirement to label cigarettes as being harmful to your health and the requirement for vaccinations to prevent fatal diseases in children.
The structure of public health services in the United States is a system of partnerships between federal, state, and local agencies and non-governmental organizations that work together to improve public health. At the federal level, there is the United States Department of Health and Human Services, or DHHS. DHHS is the U.S. government's primary agency for protecting the health of all Americans and providing essential public health services. DHHS includes many individual agencies. One of these agencies is the U.S. Centers for Disease Control and Prevention, or the CDC. You may have heard about the CDC in the news during flu season or the 2014 Ebola outbreak. CDC works to protect Americans from health, safety, and security threats. Every state in the U.S. also has a state-run health department. Some cities and counties have their own health departments too, depending on the size of the population and other factors. There may also be public health clinics that provide public health services. Public health clinics could be privately owned, may be located within a university, or could be part of a state system.
So one of the aspects of public health is to see, can we create access? So let me give you an example. There's not enough providers, let's say doctors or nurses, in certain communities. But there are people in those communities who can be trained to help individuals find the resources they need. For example, community health workers who are from the local community, they're culturally, they're ethnically, they're linguistically competent, and they can really help. So public health have invested in increasing the number of trained community health workers all over the state to provide better access.
Non-governmental agencies and charitable organizations also play an important role in public health by funding research, providing education, and offering direct services to those in need. These agencies may focus on many things, or they may have one specific focus, like policy and law, research, maternal and child health, or HIV and AIDS. Some examples include the American Cancer Society, Partners for a Drug-Free America, and the American Red Cross.
Public health is a diverse and growing field with people from many different backgrounds. There are many different careers in public health and many different pathways to get there, including technical training, college-level education, field experience, and development of special skills. A career in public health can be rewarding. Public health professionals help populations of people achieve health and wellness and prevent disease and injury. Let's talk about some of the traditional public health occupations. Traditional public health occupations are the backbone of public health.
Epidemiologists are public health professionals that study patterns, causes, and effects of disease and injury in humans and animals. Epidemiologists are the detectives of public health. They work in laboratories or offices, but also in the field, conducting interviews and collecting samples. Most epidemiologists attend college and even graduate school to obtain their training. An example of an epidemiologist's work would be to investigate a large number of reports of people with stomach illness caused by the Salmonella bacteria. The epidemiologist would track the information given and do detective work to try and figure out the source of the Salmonella outbreak. Public health planners are public health professionals who assess the needs of a population and develop plans to prevent disease and improve health for that population. A public health planner can work toward general health improvement, or they may plan for something specific like childhood injury prevention. They may seek funding for public health work or conduct education activities as well. Statisticians are public health professionals who relate math, statistics, and science information to public health. Statisticians calculate numbers and analyze data. This data is then used to help solve problems in public health and medicine. Public health educators are public health professionals that conduct research and educate the public about public health issues and behaviors that promote health and wellness. Health educators are on the front lines of improving the health of people, communities, and larger populations through teaching, education, and strategy development.
There are many occupations that contribute to the field of public health. Although they are not considered core public health careers, a few of these occupations are
behavioral health or mental health specialists, emergency preparedness coordinators, firefighters, emergency medical technicians or EMTs, and police officers, physicians and nurses and other medical professionals, veterinarians, the United States Armed Forces, lawyers, and healthcare and hospital managers.
In an ideal world, everyone would have the same opportunity to be healthy. Unfortunately, there are many factors that create barriers to achieving good health. These factors create health disparities or a lack of health equality among people.
Well, a lot of people don't know what health disparities are. So health disparities are differences in health outcomes in different populations. And so one of the ways that public health tries to work that is through a concept called focused universalism. So people who need more get more, but everybody should be getting public health information, public health services, public health interventions. So you want the entire population to be healthier, but we know that there are groups of people for a variety of reasons who may be less healthy.
Disparities in health could be due to race or ethnicity, gender, disability, age, economic status, and geographic location. Health disparities are closely linked with socio-economic or environmental disadvantages and adversely affect certain groups of people. The public health professional is concerned with health disparities for many reasons. Health disparities are found in chronic diseases such as heart disease, obesity, and diabetes that affect certain populations more than others. It is the public health professional's duty to recognize these differences and develop strategies for overcoming them. One of the most important goals of public health is to achieve health equity for all. By achieving health equity, everyone would have the opportunity to reach their full health potential, regardless of race, ethnicity, gender, social position, or other socially determined circumstances. Public health looks to remove the barriers to being healthy, not to just improve individual behaviors. A key goal of public health professionals is to understand what makes us healthy and unhealthy. There are a range of factors that determine our health status. These factors, called determinants of health, include factors that are personal, social, economic, and environmental. There are 5 determinants of health: biology and genetics, individual behavior, social conditions, environmental conditions, and access to health services and medical care. Let's talk about these more in detail.
First, biology and genetics. The inheritance of genes and the traits passed on to you from your parents that make up your hair or eye color can also cause you to develop certain diseases. For example, if your mother has had breast cancer, you may be susceptible to breast cancer too, since some forms of this cancer have a genetic basis. Some disease is inherited, but certainly not all. Public health disease screening helps a person understand their genetic risk for disease and allows them to seek appropriate medical care.
The second determinant is individual behavior. We know that many diseases can be caused or made worse by certain unhealthy behaviors, and many others can be prevented or lessened by healthy behavior. For example, you have an hour of free time on Thursday evening. Do you choose to watch an extra hour of TV or go for a walk? The healthier choice would be to go for the walk rather than watch TV. This is a behavior you control that could improve your health. One of the goals of public health is to encourage healthy behaviors through education and healthy opportunities.
Another determinant of health is a person's social condition. These are the circumstances in which we are born, grow up, live, work, and age. Examples of social conditions that impact health include poverty, lack of education, language, racism, and gender inequality. Public health agencies help address these issues through low-cost or free healthcare, culturally appropriate health education, laws and regulations to protect vulnerable people, and monitoring the health of certain at-risk populations.
The fourth determinant of health is a person's environmental conditions. These are the living conditions we experience every day and include access to clean water, access to fresh fruits and vegetables, pollution, crime, and crowded living conditions. Improving environmental conditions is an important task of public health.
The fifth determinant of health is having access to health services and medical care. Access to health care can be obstructed by language barriers, lack of insurance, high costs, and lack of availability of healthcare services in the community. One of the key roles of public health is to ensure access to health care for everyone.
When you start looking at your community, that's a public health decision. So getting involved in how your school works, how your school affects the community in which you live. You know, one of the most important influences on the health of our community is actually increasing the graduation rate of kids in our schools. So even in your own school, anything that you can do to get kids excited about studying, learning together, and graduating sharply increases your likelihood of being healthy, contributing to your family and your community.
Achieving health equity, eliminating disparities, and improving the health of all is an overarching goal for public health, allowing everyone the same opportunity to live a long, healthy life.
Congratulations on completing Module 1. Your action step for Module 1 is to explore public health resources that are available to you online. There are thousands of public health-related websites online. A good place to start is the U.S. Centers for Disease Control and Prevention website or the New Mexico Department of Health website. Go to these websites and research something that interests you. Just about anything you need to know about public health can be found on these sites. Continuing your public health knowledge beyond these videos will enable you to become a resource for your family, friends, and community.